Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to go over a quick comparison between the sympathetic shown here and the parasympathetic nervous systems. So what are some of the similarities? Well, both systems have pre-G neurons, ganglia, post-G neurons, and affected tissues. Both have pre-G neurons that release acetylcholine. Both have post-G neurons which have N2 receptors that reside in the ganglia, and both secrete their neurotransmitters through those beaded varicosities that we've been talking about. But what are some of the differences? Well, the sympathetic pre-G neurons are located between T1 and L3. We know that they have short axons, they have ganglia which are located near the spinal cord, and their post-G neurons have long axons that release norepinephrine onto adrenergic receptors, which we know are alpha 1, alpha 2, beta 1, and beta 2. Now, in contrast, we have the parasympathetic nervous system, which uses pre-G neurons in the cranial nerves and sacral segment of the spinal cord between S2 and S4 with long pre-G axons, right? The ganglia are located either near or actually in the affected tissue. The post-G parasympathetic neurons release acetylcholine onto muscarinic receptors, which are located on the target tissue. So now is prime time for when we should discuss the concept of autonomic tone, or as I like to refer to it as the autonomic tug of war. So we can understand this concept if we view the sympathetic and parasympathetic nervous system as two tug of war teams. So each system or team is constantly firing action potentials to allow our body to correctly respond to its external environment. Basically, each system is influencing the body at the same time to keep it in a sort of autonomic tension or autonomic tone. So when our body is facing an excitatory external experience, like taking a big test, you have a big presentation that you have to speak at in front of hundreds of people, you see a shark in the water while you're swimming, or maybe you're just even talking to your crush, our sympathetic nervous systems team will become stronger and will begin to have more influence on our body. This activates our chain reaction of nerve impulses that will dilate our pupils. It'll cause us to sweat. It'll make our heart rate increase. It will dilate our bronchioles. It will decrease our GI function temporarily, and it will increase our blood glucose and epinephrine concentration. So in common tongue, this is what makes you feel nervous or excited or even anxious. Now, on the contrary, what happens when we're sitting on the couch and eating a big bowl of ice cream, it's raining outside, you have some mellow John Mayer guitar music playing, and everything in the world is right? Well, this means that our parasympathetic nervous system will have more influence on our body. Then we will have a chain reaction of nervous impulses that will constrict our pupils, slow our heart rate, increase our GI motility and secretions, and we will feel relaxed and maybe even sleepy. So let's say that our patient has an allergic reaction which causes their bronchioles to constrict. Well, why do we inject the patient with epinephrine or an EpiPen or adrenaline? What system are we trying to mimic? Well, we know that the heart rate is slowed. We know that the patient is having severe hypotension. We know that their bronchioles are constricted. So what can we do to undo all that? Well, we can give them epinephrine or an EpiPen to increase the heart rate and to dilate our bronchioles and constrict our blood vessels to raise our blood pressure. Now, what happens when we go to the opposite end of that? When our patient has severe tachycardia and we decide to give them a carotid sinus massage only on one side at a time. we are directly stimulating the parasympathetic nervous system so that we can use the vagal nerve to decrease the heart rate. So I hope this video has made more clear the differences between the sympathetic and parasympathetic nervous system. And as always, thank you for taking the time to learn with us today. And remember to like and subscribe for more content.